This patient came to me with this strange skin condition on his foot. He had no idea where it came from. Check this out. This diabetic patient in his late 80s had been dealing with this change in the top of his foot for about a month. His wife was working on it, keeping it clean and putting over-the-counter antibiotic ointment and cream on it to try to get it to improve, but nothing was really helping. He went to his primary care physician, who then referred him to me. So after a month of trying to deal with this at home, this is what he came in with. He had this scaling, crusting, honey-colored lesion on the top of his foot that was actually getting bigger. Kudos to his wife for everything that she was doing for him to keep it from getting worse. So when he came to me, the first thing I did was ask a bunch of questions, as I always do. Is there anything that you can think of that could have started this off? Was there any cut, insect bite, bruise, blister, scrape, anything you can think of? And his answer to all those questions was no. So sometimes the hardest thing in medicine is trying to figure out why something happened. I could see on the exam that there was significant skin change, there was crusting, there was redness under the area while the bleeding. It's important in cases like this to remove what we call the devitalized tissue. That tissue interferes with regular skin healing. So after I completed the debridement of this lesion, I wrote a prescription for an antibiotic called mupirocin. This is prescription only. It's not something that you can just get off the counter at the store. It's very good for cases like this. So in these cases that are idiopathic, or we have no idea of what caused it, it's important to rule out other things that we think it may be, or what we call the differential diagnosis. It's not a burn because he didn't report anything hot or scalding or anything like that hitting his foot. He can't think of any scratches or cuts or insects that he may have come across. There was no fall or anything of that nature that he could think of that would have caused it. There were no new shoes that were ill-fitting that could have caused some friction or cause a blister or anything like that. So that being said, debridement showed that the outer layer of the epidermis was completely devitalized in that area of the lesion. And underlying that was skin that made it more like a second-degree burn. So I treated it as such. I wrote the prescription for the mupirocin, and slowly he started to improve again with his wife's help. Here is what he looked like 1 week after debridement. Here's what he looks like at 3 weeks. And here is the situation all resolved after 5 weeks. So what is the diagnosis here? The diagnosis here is a skin condition called impetigo. Impetigo is a skin infection that results in peeling and honey crusting and sometimes a little weeping in the area. We don't always know what causes it, but most of the time it's some type of insult to the skin, some kind of break in the skin, even if the patient has no idea what it is. Remember, this gentleman is diabetic, so he may have some neuropathy in his feet, which may explain why he didn't feel what could have caused it at the time, a month prior to coming to see me. So it's important cases like this, especially in our elderly with diabetes, that if anything crops up on their feet, anything unusual, that they see their doctor right away. Don't try to take things into your own hands in order to just try to be more convenient. It's better to go to the doctor and find out it's really nothing than to find out a month later that it really is something, like it was in this case, which could have gotten much worse if it were not for the intervention of his wife. So my friends, thank you for watching this video. Like it with a big thumbs up and share it with your friends, especially those with diabetes. Do not try to take things into your own hands. If you have a problem with your feet, see your doctor right away. If your primary doctor is unable to rectify the situation, that doctor will then refer you out to a doctor that can. So remember all these things. But most importantly, take care of your feet.